How I Ally. This is Lucinda Koza, and I am here with Marilyn Cross Coleman, my guest for today. Hi, Marilyn.
Hi, Lucinda. Thank you for having me on.
Of course. Thank you for being here. If you don't mind, would you introduce yourself and give a bit of a backstory?
Sure. Marilyn Cross Coleman, like you said, I'm a perinatal mental health treatment specialist, a PMHC, and an LCSW licensed clinical social worker. I've been a therapist I'm aging myself, but almost 30 years, and started perinatal mental health after the birth of my own son, who is now 20, during which I had a very traumatic birth experience. He ended up in the NICU, and I ended up with a diagnosis of postpartum depression. So, after that experience and all that I went through, I decided to specialize in perinatal mental health, and it's been an amazing experience. I recently opened a private practice called Shameless Mama Wellness, where I practice telehealth in the state of California.
Wow. So it's so interesting because I actually published two interviews with you, which is a first for me. So it was so interesting to see to have your personal experience first and then also see you speak as an expert. What was that like?
We all come to our various fields for a reason. And I think my own experience has given me so much passion in the field. So it's very satisfying to be able to treat all kinds of postpartum issues and especially postpartum trauma. I specialize in treating birth trauma. It is so satisfying to see women heal in in therapy. We call that post-traumatic growth, where you take a traumatic experience and you take from it what you can and you grow as a result. And for therapists, a lot of that is helping others through some of the challenges that we faced ourselves. And it's a very satisfying experience to be able to do that. Yeah.
I definitely had a traumatic birth experience with my twins. They're great and they're 19 months, but they spent almost 3 months in the NICU.
That's devastating. That's devastating. How did you get through that?
I s- I don't know. Although it's interesting, I know that there is work that I still need to do and healing that I still
Sure.
need to do because you have to hit the ground running. Even
Mhm.
though they were in the NICU, immediately I was a mother and I
Mhm.
was going through those changes, but it's how can you process the changes of becoming a mother in one instant, but also it being traumatic?
Mhm. Absolutely. It is so hard because the societal expectation is we hit the ground running. You're a mom. You have to take care of your kids. And now, especially the kids are in the NICU, they need you even more. And we're still dealing with the trauma, psychologically, the trauma to our body. And it's so hard to create that balance. How much energy do I retain for myself and my own healing? And how much do I give? And it's so hard because what we are told is we give and we give, and there is nothing else left. And part of it, I think, is as a society, we need to redefine self care, especially for mothers. Self care is essential for the entire family. If mom has nothing to give, then nobody is receiving in the entire family. So we really have to reconceptualize that and we have to focus on that self care. And it's so hard as a mom, especially when your babies need so much from you. So I'm so sorry you had to go through that. And I know you said they're 19 months and it seems like a long time ago, but it wasn't. When you'll be healing from that for a really long time.
Yeah, and I appreciate you saying that because, yeah, like, there's no way I would get over that experience, obviously. But like you said, society just expects bounce back. Like, how quickly
Mhm.
can you bounce back? And it's just not realistic and it's harmful.
Yeah, it's absolutely harmful. And having a child in the NICU, I think the devastation of that distance from your child, it was beyond words. I can't even really put that into words for someone who hadn't felt that separation right after birth. When you were supposed to be skin to skin, you were supposed to be fully connected with your child. To have him in a separate place, it was heartbreaking and so painful. And again, it's hard to put into words for someone who hasn't felt how hard that is.
Yes. I feel like you're speaking like my brain because it, that's exactly what I felt. It's exactly how I felt. And there was shame. And just like you said, I was completely unprepared to feel that way. And it was overwhelming. I felt like it was my fault that I couldn't keep them inside longer.
And that's the place we always go as moms. What could I have done? And I think part of that is an attempt to control, right? If I know if there's something that I can do that I can change my behavior, therefore I will prevent it from happening again. So it's really the illusion of control. And at the same time, we're punishing ourselves and we're feeling this pain and this shame that is so difficult to bear. But that is the first place we go to. My son in utero was diagnosed with he was found to have one kidney, and they didn't know why he only had one kidney, and so we had to do a lot of testing to find out what was wrong and what was creating it. But the first thing that I thought was, what have I done? What did I do? What did I not eat? Oh, I drank that beer before I knew I was pregnant. What did I and just searching my past behavior and everything to find a way to make that something that I had done. And I remember that the pain is just like a knife in your chest. The shame of the guilt and trying to determine what you have done to create this situation for which your child is now suffering. And that feels almost like a universal maternal response.
It does. And shame, actually, I think is quite possibly the most insidious thing that one can feel.
You
I
are
really
absolutely correct. It is, and it will impact every molecule of our being. Everything that we are can be poisoned by shame. It's incredibly destructive. And I've named my practice Shameless Mama Wellness because my personal and professional goal in life is to eradicate shame from the maternal experience. We when we find out we are pregnant, we get all the books and we have what to expect when you're expecting, and we are prepared and we have all the gadgets we need, and we know about sleep training and we know about breastfeeding. We know all these things. And the one thing that they never prepare you for is maternal guilt and shame. And I remember when that hit, it hit like lightning. And it just never goes away. I think at the end of the day, we will review what we have done for the day, and we may have been a stellar parent 99.9% of the day. We're going to focus on that 0.1% where we raised our voice, we lost our temper, we were not our best selves, and we will perseverate on that. And I got to tell you, my son is 20 and it does not go away. I will hang up from a conversation with him and he's in college. Oh, why did I say that? Oh, that was insensitive. Even though he's called me, I am incredibly important in his life. He calls me for relationship advice. He's a 20-year-old. So I know that I have done a good job. I know that we are close. I know we have an amazing relationship, yet I am going to find the one little thing I screwed up on. And I'm going to play it over and over in my head. And I want to start with moms who are brand new to start addressing this. And hopefully, when their kids are 20, they have that under control. Because I still don't.
Wow. And so you think that's possible? Like, quite literally, you think that's possible? You have
I
to.
think it Yeah, I think it is possible. I think it's possible. I think it will take a lot of work, but I think the more we raise awareness about it and the more we allow women to speak about it, because shame is so insidious, like you said, we do everything to keep that from coming to light. If I speak it out loud, then everyone will know that I am terrible, right? So
Yep.
when you speak it out loud, you know that everyone else is feeling the same way. And as soon as we normalize an emotion and experience anything, then we start to understand it and we start to understand how universal it is and how it's simply not valid. But it starts with awareness.
Yeah, it's women face obstacles when coming forward anyway to speak in general.
Mhm.
And on top of that, shame, it can keep us from reaching out, and that can make us cut off from support systems, and it's shame is terrible.
It is. It is. And silence is terrible because you're right. It keeps us from opening up to supportive and understanding people who will validate us, who will listen, who will hear. And so silence makes you suffer alone. So again, it's about awareness. It's about talking about it. Let's bring these conversations to awareness. Let's help one another through it. And moms can be the best absolute support for other moms. Let's talk about these things on the playground. Let's talk about our feeling, really talk about our feelings. And it's all exacerbated by social media. And we are literally seeing the picture perfect moments in people's lives. Let's stop doing that, folks. It's not representative. This is not what's really going on in our lives. If you're going to post about your life, be honest so that other people can do the same. I'm having a bad day. I don't feel great today. I made a mistake today. I'm having these kinds of intrusive thoughts. Let's talk about it because when we misrepresent our lives on social media, everybody else does the same. And there is no honesty, there is no truth, there is no connection, not real connection.
That's an enormous cost.
Yeah, it really is.
It's not worth it. How close does your trauma feel?
Not very close at all. It's been 2 decades, and I have done so much work around it. I think you also have to grieve the birth experience that you didn't have. I don't know how much of that I have done. I was talking to my niece yesterday, actually, who's going to be starting a family soon, and she said, "Oh, I just hope my birth experience is what I expect." And I said, "Oh, babe, don't have those expectations. You only set yourself up for disappointment. And the picture perfect births that we see and we're made to believe are what we're supposed to experience are very rare. And so from the get go, we're set up for disappointment. We have these idealized versions of what birth should be. And it is a lot of time. And there is magic in the painful moments and all of that. But a lot of time it doesn't go to plan. A lot of times breastfeeding, which are taught to believe is so natural. You put baby to breast and they eat and everything is wonderful. That rarely happens. And then from the get go, moms are made to feel that they are a failure as a mother. I cannot sustain my child. I cannot do the basic things that I'm supposed to do, right down to feeding and sustaining him. And therefore, I am unworthy. And that's what happens.
It's almost it's almost like it's designed to be disempowering.
Yes. Empowering to women, which many things are designed to be disempowering to us.
And in the very thing that is actually the most badass thing that we do, we are disempowered.
At the pinnacle of our power, we are disempowered. Yeah, I can't help but think that's not by design a little bit.
I know. Yeah. Your practice, obviously, the fact that you specialize in birth trauma, that I don't think I've heard of that, which is outrageous because I that's literally what went through and have needed. And even my husband, I'm sure, needs healing just
Mhm.
because he was there.
Yeah, no, absolutely. You watched his babies go through the same thing that you did. Thankfully, I think there is a growing understanding or the emergence of an understanding that sometimes we do have these traumatic birth experiences and they need to be validated, they need to be seen, and women need to heal. That's relatively new, right? We didn't have an understanding of birth trauma. Really, it wasn't on our radar for a long time. And I'm so glad it is now because it's been around forever. So I do think as a society, we're starting to understand these are experiences that have to be healed, they have to be treated in order for moms and babies to bond most effectively, in order for mothers to heal and be able to be present. So I am glad that people are starting to look at it.
Absolutely. That post-traumatic growth, that's what you said, right? That is I just heard that term or that phrase like a couple days ago,
Oh, really?
and it yeah. Yes, which is also bizarre, but I felt that when I was in when my children were in the NICU, it was like I felt like, how do they know I'm their mother? And I felt all of these, like, other people, like, touching them and the nurses and the doctors, and I didn't I felt very insecure about my place as their mother,
Yeah, absolutely.
and I think the growth that happened was that I hit bottom at some point, and I was just like, "Damn it, I'm their mother, and I have to be, and I am, but I have to feel that way. I just have to. Like, no one can take that away from me anymore." And it was amazing how that growth it almost seems like post-traumatic growth is like a miracle or something. Like,
Mhm.
it just
How do you think you arrived at that place?
I think I had no other option.
So you made that decision.
I think felt because of the circumstances and the trauma, I felt they don't know I'm their mom. No one treats me with any sort of, like, respect or I don't know.
That's another thing with birth trauma is a lot of it stems from the way hospital staff, and they're well-meaning. I don't think that they mean to treat mothers this way, but a lot of times we lose our autonomy and we do lose that sacred place as mom. And medical decisions are made without our full consent or knowledge. Things are not explained, and we lose the sense that our body is ours. We lose the sense that our children are ours. So it sounds like that's a little bit of what you are relaying as well. So I use a trauma treatment for birth trauma called EMDR, eye movement desensitization and reprocessing. And it is an evidence based treatment that works neurobiologically to rewire the brain, essentially, in a nutshell. It works very well and very quickly. One thing about birth trauma is when we experience birth trauma, a lot of times it will reignite previous traumas in our lives. So it has a compounding effect, and we have to treat the birth trauma. And then you see, especially through EMDR, because it works neurobiologically, how neurobiologically this trauma is connected to previous traumas and then intensified. So that's a treatment that I use that's very effective. And it's another part of being really satisfying as a form of treatment because you do see moms heal. A lot of moms will come to me for birth trauma treatment when they are starting IVF because their trauma is preventing them from really moving forward, and they fear they might have had multiple losses, multiple disappointments, and they fear that disappointment and loss. And the satisfaction level is off the charts there because we can treat the birth trauma, we can move them forward, and then they are more emotionally ready to start this new journey. So that's a really effective treatment.
Important to differentiate the journeys. Like this was IVF. Now this is pregnancy. Or I feel like for me, everything just blended together.
Mhm. It does. And that's the way trauma works. We really store trauma in memory networks in our brains, and they're connected. I always use the analogy of you open up your jewelry box and all your necklaces are tangled. Most women have done that. We used to take like a safety pin and try to untangle them all. But when it's a mass, a tangled mass, it's so hard to tell where one necklace begins and another one begins. And it's like that with these traumatic memories. They bunch together in these memory networks. And EMDR especially will start to pull those memories apart and process them. It also has a domino effect. So when the memories are held in a memory network and we start to process one, the domino effect will hit the other traumas and process them as well. So but it does, your brain gets a little bit jumbled there when you pile all these things on top of it.
That is such a good metaphor. It provides hope.
Yeah, there's definitely hope. These are things that can be healed. And again, we have to speak about them. We have to recognize and acknowledge and validate, and then we can heal. But birth trauma is very treatable. It doesn't, women do not have to suffer with it.
That's a beautiful statement. I have not heard that.
Yeah.
So that's a very hopeful message.
I think a lot of women too are not, they don't identify what they experienced as traumatic. And I've seen that in a lot. It was painful. I wouldn't call it traumatic, and I don't ever try to put words into someone's mouth. I call it what they call it. But I also like to introduce if it felt traumatic to you, then it was. And maybe what you experienced would not be traumatic for somebody else, but it was for you. And you get to own that, and we get to work on healing that.
That is so important. It's I come back to shame. It seems also I think women are conditioned to belittle their experiences
Growth through. Mhm.
and to say, "Oh, it wasn't that bad. It's not that bad. I know that other people have much worse."
Yes. Yeah. There's some sort of hierarchy of suffering in life, and I'm not entitled to my suffering because someone had it worse. Someone will always have it worse. That does not mean that what we experience was unimportant. And with birth trauma, there's this bright side mentality. Well, look, you have this gorgeous baby. It's okay. That's going to cancel out all this pain and suffering. And I wish the world worked that way, but it doesn't. And moms understand they have a beautiful child, and Nobody takes that for granted, but we also want to be seen for the pain that we've experienced. We also want to be able to have somebody connect with that and validate that.
Yes, to feel seen. After giving birth, I felt so invisible.
Yeah, we do become invisible. It becomes about our babies. Just the other day, I went into my other niece's house, and she has a 2-year-old, and everybody rushes to pick up the baby. Oh, we give him kisses. How are you? And I said, I'm sorry. I just walked right past you and said hi to the baby. You're important too. Give her a kiss. I love you too. But we do, as a society, it's all been all eyes are on baby, which as it should be, and baby needs all eyes on them. But mom needs to be acknowledged as well, especially if she's in pain, especially if she has needs that aren't being met.
Right. Yeah. That is like more trauma. That can be more trauma if you are dismissed or don't feel seen.
Yeah, absolutely.
But it's such a great hopeful message that you had. It's not even a message, it's a fact that it's so easily treatable.
Yeah. Yeah. No, it really is. It really is. We just need to talk about it more so people come in for treatment.
Right. Exactly. And that takes a lot. It
Yeah,
can take a lot.
it certainly can.
I feel like I feel like I took advantage of your profession and I talked to you like you're my therapist. I'm
No,
sorry.
no, that's important. It is important because you are every woman, right? You are every woman who's experienced birth trauma. Let's make that okay. Let's have those discussions. Let's talk to everyone and get their opinion and input, whether they're a therapist or not. It's important to be honest about those things. And I appreciate your vulnerability. That's hard to say. And by your doing that, you allow other women to do that as well. So I appreciate that. Thank you.
Thank you. That's so true. Thank you for being my guest today, and maybe we'll do a part 2 since there was a part 2 interview in Authority magazine.
Absolutely. I would love that. I really appreciate you having me. Thank you so much. And thank you for talking about this important subject. I hope that it inspires other women to do the same.